Okay, so like you heard, Austin Travis County EMS, with collaboration of our partners at Austin Public Health, have deployed a class called Breathe Now, with the intention to start addressing some of these preventable opioid deaths that we're having within our community. This is an epidemic, as was stated previously, and it's not just here in Austin, it's nationwide. And through the planning, collaboration, and policy that has gone in place, we've been able to create something like this, the Breathe Now class. And that is just a portion of our comprehensive wraparound services that we provide for people within our community to address this opioid epidemic. And so today we're just going to kind of walk through briefly the high-level points on this class. And understanding that the mission of this class, as we state here on our front page, is to combine education and resources, right? Education on its own is not enough. I can educate you to the benefits of Narcan, but if you don't have that, then you're not going to be able to respond, right? Just like giving someone a Narcan kit without the education, without the understanding of when to deploy that resource, again, is not that great. And so we want to combine those two things, education and resource, in order to reduce these preventable deaths that are occurring from opioids within our community. And all of y'all have, usually I'll have like a beautiful like TV or PowerPoint behind me, but we're going to have it here on our piece of paper. So our objectives for this training are first to be able to recognize what an overdose is, right? And then understand the progression of an overdose, so then we can respond and then properly administer Narcan. One of the biggest issues that we're seeing with this spike in deaths is introduction of fentanyl into our community. That is really leading to a lot of negative outcomes, an increase like we saw last Monday over those 72 hours, the increase in overdose calls. And that's not just, again, here in our community, that's a problem that's occurring nationwide, right? So our collaboration is not just with Austin Public Health. We are collaborating nationwide and learning from people, different departments, what they've experienced, and then deploying that here within our community. As you can see, this is the difference between a real prescription pill, a Xanax, and one that's fake. We can't tell the difference, right? And that's what's happening within our community. Often people are not even knowing that they're taking an opioid. They think they're taking something to help them sleep or something to help them with depression or their mood, and it has fentanyl mixed in because it's not a prescription medication. It's something that's been pressed, and it has fentanyl in it. And then we're having these negative outcomes. And we saw that again last week on Monday when we had our significant outbreak. Another issue that we have when we're starting to address these overdoses is the stigma associated with people with this disease, right? People who are addicted, we have to understand that it's a disease process, and once we understand that, then we can deploy a program to properly address the disease, right? People who are diabetic, sometimes they can lose weight and then get their sugar under control. Sometimes they need a pill, and that helps them with their sugar under control. And sometimes they need insulin, and inject that, and that does it too. If we understand that addiction is a disease, we can then get them the therapy that they need. Sometimes people can quit cold turkey and they're totally fine. Sometimes people need peer support and therapy, maybe go to meetings on a weekly basis to keep that addiction at bay. But sometimes people need more. Sometimes people need medicine, and that's what we're here for. So again, this class, this Breathe Now class, is the first step into making sure these deaths are reduced or eliminated within our community. There was a question earlier about the difference between being high or an overdose. We have to understand that when someone ingests something or takes a drug and they're high, it does affect their brain, but it doesn't affect their core systematic vital signs, right? And so they might be sleepy, they might be talking slower, but their heart rate is normal, the respirations are normal, they look normal, other than they might be a little bit slower, or there could be a variety of symptoms that they would see. But when you overdose, that's when we're seeing that systematic effects, right? That overload on the brain, where now it's really affecting your respirations to a point where you might stop breathing, and then that's where we're getting our negative outcomes from. It's people who are not breathing effectively enough and or stopping to breathe, and then they have decreased oxygen, which leads to cardiac arrest. And so these overdoses can occur depending on the substance that's used. It could be within minutes, but typically they occur within 1 to 3 hours of the drug that's taken. Again, it depends on how the drug is taken, if it's inhaled, if it's ingested, or if it's taken intravenously. There's lots of various reasons why someone might have an overdose, right? Sometimes it's multiple drugs combined together. Sometimes it's someone who has been clean for a while and then goes back and has a relapse, and their tolerance just isn't the same. There could be someone who's released from jail and goes back to using, hasn't used in a while. And they think that they go back to what they used to do, and their body just isn't ready for it, and it could have a negative outcome. And so we need to understand that. The progression of an overdose, first, I guess there's that ingestion of an opioid or a substance. You're going to start seeing the breathing slow. That's because brain receptors are getting overwhelmed by that opioid, and it's causing a slowing of the breathing to potentially even stop the breathing. They're going to lose consciousness. So someone who's high, you can arouse them if they're sleepy. You can stimulate them and they'll wake up and talk to you. Someone who is overdosed, you cannot. They will lose consciousness and they will fall asleep. And with that breathing that's impaired, that leads to other things. Again, like I said, that breathing that's being slowed deprives the brain and other organs of oxygen, which then can result in cardiac arrest and irreversible damage to different organs. And then ultimately, if no one intervenes, it's death. What we need is a response to that progression, right? So someone ingests an opioid. What we need it to be recognized first, right? We need to understand that danger of that event and recognize that it's occurring. We need people to call 911. Call 911 and get us started. We don't know how long it's going to take for us to get there. Regardless of where you're at in the city, we don't know how busy the system is, right? So get us started, get Austin Travis County EMS, the fire department, the police department started so that we can help you in this event. We then need you to administer Narcan. If you have Narcan, we need it to be administered. And so that way, hopefully, it will start reversing those effects of that opioid and bring back those respirations, and that person can wake up and have minimal negative effect from that period of apnea or the not breathing or the decreased respirations. In our Narcan kits, we also provide mouth shields so we can actually support respirations. Because again, that's the main part, right? It's the lack of oxygen. So if we can breathe for them until they start breathing on their own, that again helps reverse or at least curtail that negative outcome or impact of the lack of oxygen in their system. So if you know how to do that, we encourage you to do that safely and support the breathing, and then place them in a recovery position. So that's on their side, just in case they were to vomit or they have extra fluid in their airway that doesn't get into their lungs and cause like a downstream pneumonia or other things that could happen, okay? And we really want you to do that and provide that care until EMS arrives. So stay with that patient and continue to provide that care. We need to understand that Narcan itself, it actually attaches it to those same receptors that the opioid does in your brain. That's how it works. But it has a greater affinity. It has a greater attachment to those receptors. So it bumps off those opioids that are on those receptors in your brain and then fills that space so those opioids cannot come back, right? That Narcan lasts anywhere between 30 to 90 minutes. And so there's still the fear that even after someone has given Narcan, the Narcan wears off, they can still have the opioid in their system, and they can reattach, and they can go back to being unconscious. So we always recommend people to seek further medical attention at an emergency room, but we definitely don't want someone to be alone after having an event like this. So if you give someone Narcan, we need to understand that risk, and we need to stay with that person, and hopefully they'll be agreeable to further medical care at an emergency room. And then, of course, Narcan is not going to work it's not going to work on someone who's drank too much, right? It doesn't reverse alcohol. It doesn't reverse methamphetamine. It's specific to an opioid overdose, right? But it's not going to be harmful either to someone if their overdose is not opioid related, right? It's one way to kind of rule that out. I heard a question about storage, different manufacturers. And again, I should have mentioned this earlier. Narcan is a generic name. The actual drug is in the lock zone. So you might hear both of those terms being used, and we use them kind of interchangeably throughout this class. Depending on the manufacturer, there's recommendations for storage. We recommend storing it between around room temperature, 77 degrees. is not very much research that has been done with temperature excursion, so we're not quite sure the impact on efficacy, but we recommend looking at the package and coming up with a storage plan according to manufacturer's recommendations. We also know we want to block it from sunlight. That's why in the package the drug is in a solid white administrator, and so that way the medication is blocked from any sunlight. We also want to make sure people understand the legal that legally, given the Good Samaritan law, people are covered. You're not going to get in trouble because you've given someone Narcan, right? It's just like CPR. If there's an emergency and someone needs help and you're helping and doing what you're told to do, you're using it properly, you're not going to be in trouble for administering Narcan to someone. So when we talk about Narcan administration, again, there's instructions that come with the medication themselves, but our administrators that we're handing out right now look just like this, right? And so what we need is you're going to remove it from the packaging, and then we're going to place the white tip into the nares of, or the nostrils of the person who is overdosed, and then we're going to plunge the red portion so it atomizes or sprays out the medication up into their nostrils or their nares, right? Where it's very vascular, there's a lot of absorption, and so that's how this medication works. And so did you want to?
Sure. Yeah.
Oh, you have one?
Okay.
So show us how it's done.
All right. Second nostril?
Yeah, any nostril.
All right.
And so we're just going to bury it up there.
Plunge it?
It's that simple.
That was easy.
It's that simple. And what we're going to do is give it 3 to 5 minutes to work, right? If you're not seeing improvement in the patient or the person's presentation, if you're not seeing improvement in their breathing, then we have a second dose in these kits. We can go ahead and administer that second dose at that time. But we want to give it an opportunity for this medication to work, and then before we go ahead and discharge that second dose. And then after, again, we discharge it and we're seeing an improvement, we're going to roll them onto their side into a recovery position. Again, that helps protect their airway. We want to stay with that person until EMS arrives. If you were to administer this to someone, you need to understand that when they wake up, they can be a little confused, right? We had last Monday so many people say they ingested something that they didn't realize was an opioid, and next thing they knew, they woke up and were standing there. And so you can understand if someone's confused in that moment, it's not that they're going to be potentially violent, but they might respond in a certain way. And so we're going to be kind, give space, reassure, and again, keep yourself safe, but give as much space as needed. We should have already called 911, so help is coming. But understand that there is that potential, that there's that confusion, and you might have a response from that confusion.
Is this information available online?
The presentation is not available online, but there is education that aligns with this that is available, that we can get out.
I have two.
Yeah.
So summer is coming, and I know it says 104 degrees, so probably not my car is the best place to store it.
We do recommend having a plan where the medication is not left in the vehicle, because we don't know with those temperature excursions what it does, if it affects the efficacy of that medication. And so not knowing, it's good to have a plan and go along with what the manufacturer recommends. And so that recommendation is directly from the manufacturer. So yes, so bringing the kit inside the house, or having a system where if you do remove it from your vector of transport or how you would normally deploy it if you're out in the community, that you have a plan also to remember to bring it back.
My second question is, my son is old enough to drive and be out on his own. Is it safe for parents to kind of coach their kids on what to do and give them a kit, or what's your thoughts on that?
Yes, so Narcan or naloxone is extremely safe. From people who are pregnant to kids, it's a very safe drug. Again, it only works if someone has opioid in their system. There's no downside to administration of Narcan.
Train an 18-year-old how to, okay.
Absolutely, and we want as many people trained as possible, because as you heard, these events don't discriminate. It's not a certain demographic. It's not people experiencing homelessness only. It's anyone. right? We are all over Travis County experiencing overdoses. And if there is a through line, it's typically someone who's vulnerable, who has experienced the trauma, or who's unaware of the risks or dangers associated with an action. And they might be out having fun and thinking that they're taking something like a Xanax and not understanding that there could be fentanyl mixed in to that medication.
We had a question earlier on about the expiration date, and it's right on the back of the container. And so I guess if we have someone who got this last year, they can check. I see all of these, I guess, are new or October of next year, so they can be replaced if someone doesn't need to use them but wants to have them available.
Yes, yep, absolutely. And so depending on the manufacturer, the expiration might vary. These seem to be 2 to 3 years. I couldn't find a data manufacturer on that product that you have in front of you. But within the kit, there's also education. And within this education, there's a phone number that people can call to get connected to replace their Narcan kit, right? And then we have the education in both Spanish and English. And so the question, what would happen if we gave expired Narcan? I'm not sure. Depending on how expired it is.
We've used it.
Dr. Abraham said expired Narcan will still work.
But that's all you have.
Of course, for sure, yes. It's not going to cause harm. Do you have any other questions?
Can I take this?
Absolutely, yeah, absolutely. Yep. And so, I know there's some myths out there around Narcan, right? And some of the things that we've heard is that Narcan, actual product or programs like this, actually encourage people to use opioids, and obviously that is a myth, right? Again, like we talked about, if someone has an addiction or if someone is unaware of a risk, having Narcan is not going to encourage someone to use an opioid, right? It is here to save lives. It's not only for medical professionals. Anyone can use it. It's over the counter, and it's not going to increase anyone's tolerance, and it does not make people violent. Okay? The one fact that we want to kind of hone in on is that Narcan saves lives, and that's a fact. And it takes all of us to understand that, to be educated to that, and have the resources available so that if we're ever in a position that we need to respond, that we're able to do that.
Awesome.
So I appreciate you guys.
Great job.
Thank you. Thank you. So, someone who has lost their pulse, or if you cannot find a pulse and they're unconscious, and then when you call 911, that dispatcher is going to help guide you through those instructions, and that's when we would be doing CPR. So there are times when someone has an overdose and their respirations are decreased or stopped, but their heart is still beating, and so that Narcan will bring the respirations back. If we're not sure, if we can't get a pulse and someone is unresponsive, then we need to do CPR.
I would do Narcan first and then CPR. The good news is so everybody should get training on this stuff, but if you forget what you got taught, as soon as you call 911, the dispatchers are going to walk you through exactly what to do step by step. So you don't need to remember which thing do I do first. Like 911 will walk you through that.
And is there if I call and I do the Narcan, is that person going to get in trouble for taking medication?
Absolutely not. We are just trying to save lives here.
Real quick clarification. So one pump is one dose.
Correct.
And there's two inside that, or are there two?
There are in every kit we provide two administrators.
One single dose, one pump.
Yes, one time single dose. Yep.
Does it matter how tight you are? I mean, do you need to really get it in there?
We get in there as much as you can, right? As much. Sure. It's exactly like that.
Do you see any type of aerosol come out? Or if you do it right, will it all go out?
Hopefully it all goes in. Absolutely. So hopefully if it's deployed up into the nostril or near far enough, you should not see, but you do the best you can, right? do the best you can.
It's a large enough dose that even if some of it runs out, the patient is still going to get enough to make a difference.
They don't need to breathe it in. It's going to be absorbed by the tissues of the nasal cavity.
Correct.
There are other brands of naloxone, right?
There are other, yes.
Why is Narcan the go-to?
It's just the brand name.
It's just, yeah.
No, I know you said there's other, but I feel like all I see is Narcan, but why aren't other brands involved?
They're just the biggest manufacturer.
Okay.
And so they're the most common,
Okay.
yeah, brand name.
I do.
Yeah.
Everybody calls it Advil.
Yeah, I just know why.
Thanks y'all for coming out.
Thanks again for sticking with us here on KXAN Live. Will Dupree back at the KXAN Live studio. If you want to check out that demonstration again, we're going to clip that video and add it into the web story associated with this over on KXAN.com, so you can check that out, share it with other people that might need to see that video, because it, again, is life-saving information that really came in handy these last couple of weeks when we saw that incredibly troubling surge in overdoses throughout Austin. Once again, I'm Will Dupree. We will see you back here at another time. Hope you all enjoy the rest of your day. Take care and stay safe out there.